ABC News medical correspondent Dr. Darien Sutton, thank you for joining us. Dr. Sutton, Kensington Palace did not share what type of cancer the princess was diagnosed with, but we do know that she had abdominal surgery in January. It was believed to be non-cancerous at the time, only for tests to later show that the cancer was present. What do you make of that?
Well, what I make of it is that there's details that we obviously don't know out of respect for her privacy, but what we do understand is that this abdominal surgery led to a diagnosis of cancer. Now, how possible is that? And during surgery, it's often a collaborative effort between different specialties within the hospital, including radiology, who are looking at the images to identify an abnormality, the surgeons who are investigating operatively, the pathologists who are looking at the samples taken from the surgery to assure what was the cause, and then, of course, oncologists, if in fact that diagnosis is cancer, to help coordinate care. Now, abdominal surgery and the association of abdominal cancer can be a wide variety of different causes. But what we do understand is that she's getting preventative chemotherapy. And the main goal of that is to prevent recurrence or prevent the chances of cancer coming back after removal. Obviously, we're hopeful that this is all successful for her.
Is there anything else that you can tell us about that preventative chemotherapy? What else we might be able to learn about that procedure?
Well, preventative chemotherapy means something different for each patient, and it also can be dependent on the type of cancer that you're talking about. You can also provide chemotherapy in different methods. One method, for example, is a targeted method where you localize and focus on the cancer itself. And then another is a more general method where you give the patient what I would seem more conventional idea of what chemotherapy looks like. That's more likely to be associated to the symptoms that we commonly know and associate, such as fatigue, hair loss, and weakness. Unfortunately, we will never know probably the likelihood of or the causes of what led to this type of chemotherapy, but at the end, we hope is that this is going to be the end of that process, but there'll likely be screening and other issues or other modalities that come into play afterwards to make sure that this is successful and that there's no recurrence and that she can move on with her life.
And Princess Kate is just 42 years old. It raises the issue of cancer in younger adults. The most recent report from the American Cancer Society showed a troubling spike here, increased rates for 6 of the 10 most common cancers in people under the age of 50. So at what age should people really think about getting cancer screenings?
Well, I think that conversation has to happen with your primary provider, and it's dependent on your personal history, your family history, and also your goals. When we have these conversations in general, I think they should always start when we're talking with our primary care providers regarding what type of screening is appropriate, whether we're talking about mammograms, colonoscopies, or screening for prostate cancer. All of these are really important, and I think a reminder that we have to make sure that we stay up to date with those screenings and have open and honest conversations with our providers.
All right, Dr. Darien Sutton, we definitely appreciate your insight tonight.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.